Lupus is a multi-system disease that can affect any number of organs. It's basically a connective tissue disorder, developing a kind of autoimmunity to various nuclear antigens. There is a certain amount of genetic predisposition along with some environmental factors. So those are the most common reasons, and there is a significant amount of racial differences between the incidence of lupus. There are different types of lupus depending upon what organ system is involved. Most of it is possibly related to dermatological, shows up as discoid lupus, whereas plaques develop and rashes on the skin. This is discoid lupus. Then the other will be a musculoskeletal type of a lupus, where it involves the joints and synovitis and joint pains and joint swellings. Rashes, especially a malar type of rash on the face. It's called as a butterfly rash because it mostly to the cheeks of the, excluding the in between the eyes. So that's a butterfly type of rash. It can also involve the internal organs. You could have a lupus nephritis. You could develop a lupus hepatitis. You could even develop a central nervous system disease such as a lupus cerebritis, which involves the central nervous system and the brain producing seizures. There is definitely a genetic component. It's significantly higher incidence in African Americans and significantly lower percentage in Southeast Asians. For 100,000, there's only 2 you get in Southeast Asians, whereas 25 to 24 in Caucasians, and up to 60, 70 per 100,000 in African Americans. Symptoms of lupus initially can start with a rash, and especially a rash on your face. Can develop some joint stiffness initially, which is arthralgia. When it gets untreated and left alone, arthralgia can go into actually synovitis and arthritis. Those are most common symptoms. Fatigue, constitutional symptoms are very common. So the diagnosis of lupus is not very straightforward immediately. So there's always a delay in the diagnosis. It takes 6 months to a year before, say, the different doctors and finally somebody puts together as lupus, because the initial involvement can be very mild and also can be varied because it can affect different organ systems. But most of the time it's the skin rashes and the constitutional symptoms of fatigue, tiredness, a low-grade fever. American Association of Rheumatology diagnosis, and the same way there's a European Rheumatological Association also. They have to at least have 2 or 3 clinical symptoms, which will be either arthralgia or some form of constitutional symptoms, along with a laboratory evaluation, which is evaluating for the anti-nuclear antigen. And they put in a particular titers because ANA is not pathognomic for lupus. 25% of normal population have a positive ANA. So they specifically put as a 1 in 80 dilution. If it is positive, then we consider it possibly looking into lupus. You can have just a mild stage 1, or you will have just some rash and a little discomfort from the rashes and some skin irritation and some fatigue, to the worst scenario where you can have a lupus which will be detrimental to your kidneys and go into renal failure, can go into liver failure, can go into full-blown cerebritis and dementia, and also including seizures. Sometimes if it is just a rash, maybe you can get away with just a local steroid cream. If it involves more constitutional symptoms and musculoskeletal symptoms, the first drug we choose is an anti-malarial, although nothing to do with malaria, but the anti-malarial hydroxychloroquine is the drug of choice. We start with 400 milligrams per day.